Harmony. I'm a nursing student at Williston State College, and I'm going to show you wound care and how to wrap an ankle with an ACE wrap. I have already assessed the patient. Her pain level was at a 6 out of 10, so we gave her an as-needed pain management about 20 minutes ago. So I'm going to review the provider order for the wound dressing. She is Shirley Coast, 4/3/1987. She needs a daily dressing of the wound with a wet to dry dressing, and we're changing that as needed. At 9 o'clock, we will obtain a wound culture, and it's getting close to that time, so we'll grab our supplies and head in there. And then we'll also be applying an ACE wrap on the left lower extremity. So I'm going to gather my supplies and then head into her room. Hello, Shirley, I'm back. Can you verify your name and date of birth for me? As she's doing that, we'll close the curtain, and she said Shirley Coast, 4/3/87. I'll raise the bed up. Scan her bracelet. I don't see she doesn't have any allergies. Do you have any allergies, Shirley? No? Okay, perfect. Well, I'm just gonna expose your leg here. Feeling pretty good after that pain medication? You're at a 2 now? Oh, good. No shadowing on this bandage. Perfect. I'm just gonna open up my wound cleaning kit and get the bio bag. Okay, then I'm going to prep my saline. So we're going to get our supplies out, place this back in there. We may or may not need it. Then we'll lift the saline and then pour it in here. Okay, now I'm going to wash my hands, put gloves on, and don PPE. All right, Shirley, can I have you lift your leg up so we can put this pad underneath to protect your bedding? Thank you. All right. So the bandage looks good from here. We're going to remove it. Take a look at underneath. It's extra sticky tape, Shirley. Good thing you've got healthy skin along the sides of your wound. All right, so I'm going to examine this. I see a little bit of red-pink tinge to it, a little bit of yellowish from the sloughing. We can discard that. There's not a whole lot. It's not super moist. I'm going to look at the wound. I see a little bit of sloughing, eschar right there. Push around the edges, and I'm not getting any pus. There's a nice pink wound bed. There's no pitting edema or anything like that. Is there any pain when I'm doing this, Shirley? Just a little bit? Okay. Well, we're going to start cleaning it now, so I'm going to get my syringe ready. And we're going to use an AngioCath tip and a 30 milliliter syringe. So we put the tip on, maintaining a sterile tip on the tube. Get my basin, set that there. And then we will also grab some gauze. All right, let me know if you have any pain or discomfort. We're going to draw up 30 mils of normal saline. Holding the AngioCath tip about 2 inches away, we're going to go starting from the top to the bottom. You'll do this until you get a clear return. Okay, that looks good. We'd this over here, and then we'd get a new gauze, pat it dry. Doing okay, Shirley? Good. Then we will collect our wound culture. So I'm going to get my wound culture, and we're going to collect the specimen from a healthy wound bed. You don't want to go into the sloughing. So we'll carefully get it in this pink wound bed, swirling it around a little bit, and then place it into here. Then we can discard that in the trash. We'll put her name, date of birth, time of collection, date of collection, my initials, and then I'll have my CNA take it down to the lab for me. Then we are going to get rid of the sloughing that's left over. So I'm going to grab my pre-saturated swabs. All right, Shirley, no allergies to shellfish. These are iodine swabs. No? Okay, good. So we're going to start at the top, swirling down until it's saturated and covered. Then we'll grab a new one. Start at the top again, working our way down. You're doing good. Looks like it's healing really well down here, Shirley. And I'll have you turn your foot for me for this last little corner. Perfect. So we are all done cleaning it. I'm just going to measure the wound before I start the new bandage. And this is a paper measurer, so we can discard it when we're done. It's a one-time use. So we've got 15 centimeters by 13 centimeters. Okay, Shirley. So we're going to get rid of the dirty, place that in the bigger bottle, remove my gloves, wash my hands. We're going to get a new one of these. And then I'm going to prep my saline again. So we're going to lip it. I don't have gloves on right now. Pour that into the basin. And then I'm going to put on new gloves, grab a gauze, and we're going to fluff it. And then we will saturate it, squeeze out any excess. Then we'll just want to place this on the damaged tissue, not the healthy tissue, because it can inhibit normal healing process. So we'll want to make sure it's only touching the damaged tissue. Okay. Then we're going to grab 2 clean gauzes that are dry, place them over top. How you doing, Shirley? Good, good. Okay. Then we're going to grab our abdominal pad and place it over the top. And it's the perfect size for your wound. And then we'll just get our tape. And one last piece. All right, how's that feel, Shirley? Good. I'm going to remove my gloves, remove my PPE, wash my hands. And before I would have removed my gloves and washed my hands, I would have gotten this discarded. And then we're going to cover up that leg. All right, Shirley, we have one last thing we have to do. We're going to wrap your left lower ankle with an ACE wrap. Okay. Do you have any questions? No? All right. Have you been having much pain on this side? No, it's been doing pretty good.